You're joining us. Your mother has Alzheimer's. How is your mother doing now? First of all, we should talk about it. And how has UCI Mind helped?
Yeah, my mom's doing great right now. Actually, her attitude is partially why I think she's doing so good. And that's largely attributed to my father and what an awesome caregiver he is. So he's really stepped up is what he's done. And ultimately, that's why she's doing so well.
You're joining us. Your mother has Alzheimer's. How is your mother doing now? First of all, we should talk about it. And how has UCI Mind helped?
Yeah, my mom's doing great right now. Actually, her attitude is partially why I think she's doing so good. And that's largely attributed to my father and what an awesome caregiver he is. So he's really stepped up is what he's done. And ultimately, that's why she's doing so well.
You're joining us. Your mother has Alzheimer's.
Lucy retired, and I had already been retired for a couple of years. And we plan to travel the world and see more and more of our grandchildren. But on November 1st, 2010, just 5 months after Lucy retired, we got the information that Lucy had early onset Alzheimer's and that our journey would change. We were fortunate to be able to have a contact that led us to UCI Mind. And we've been with UCI Mind for 5 years now and working very closely with their researchers and in their research program. And our desire is to do what we can to help to find a cure for this disease.
You know, I look at my dad and what he does day in and day out. He is on his game 100% of the time, taking care of my mother. Thank you, Dad.
Good afternoon, and welcome to this session on caring for the caregiver. My name is Josh Grill. I'm a faculty member in the UC Irvine School of Medicine and the School of Biological Sciences, and I'll be the moderator for today's panel on caregiving in a time of the COVID-19 pandemic. We're really delighted that you've made time to join us this afternoon. I want to begin by thanking Roger Lisbeth and his family for allowing us to show that video that I think gives a nice introduction to what it is to be a caregiver of a person with dementia. But of course, that was filmed before the current COVID-19 pandemic. And so caregiving has grown in its complexity and the challenges that caregivers face and the burden that comes with their role. And we're really delighted to have three true experts join us today from UCI Health and the UCI School of Nursing in this collaborative session to answer the questions of our community members about caregiving. Before I introduce our panelists, I just want to take a moment to thank our colleagues at UCI Media. I want to thank Juliana Goswick and Heather Shannon from the School of Nursing, and Chelsea Cox and Kirsten Klein from UCI Mind. A lot of hard work went into making this session possible. Most of it by those folks, but not exclusively those folks, and really grateful to all their efforts. So I'm gonna introduce our three panelists who I'm sure you will agree with me have the absolute perfect sets of expertise to tackle this very important topic today. I'm going to start with Dr. Jung-Ah Lee. Dr. Lee is a nurse scientist and faculty member in the School of Nursing. Her expertise is in gerontology, and her research focuses very much on caregivers and translational delivery of care and reducing the burden of caregiving, especially in the diverse communities that are here in Orange County. She and her colleagues just recently, in fact, received a multi-million-dollar grant, federal grant, to test an intervention for alleviating caregiving burden in minority communities right here in Orange County. Dr. Lee, would you like to say a few words for our audience?
Hello, my name is Jung-Ah Lee, Associate Professor in Sue and Bill Gross School of Nursing at UCI. Thank you so much for Dr. Grill to introducing about me and then my research. And I'm a fruit of Dr. Lisa Gibbs' gerontological workforce enhancement project. So I expand my research and experience with working with Dr. Lisa Gibbs in UCI health gerontology groups. Then today I'm very happy to share my experience and then stories that I heard from individual caregivers before the pandemic and during the pandemic. Thank you.
Fantastic. Thank you. Next, I'd like to introduce Dr. Allison Holman. Dr. Holman is also from the School of Nursing, and she is an expert on traumatic experiences and stress. She studies the biological, cognitive, emotional, social, environmental, and behavioral effects on one's health of experiencing trauma. And she recently published a large study on the mental health sequelae of the COVID-19 pandemic. So really ideally suited to handle this for us today. Welcome, Dr. Holman. Could I ask you to say a few words to our audience?
Sorry, I almost started with mute. Thank you, Dr. Grill, for inviting me to participate in this session. So for 30 years, I've been studying how people respond to collective stress and individual stress and trauma. And my focus has been, as you said, on the early responses that people have and how those early responses are associated with downstream subsequent mental and physical health challenges that are related to that trauma exposure. Right now, my colleagues and I are currently focusing on a large national study. We have over 6,500 individuals. It's a probability-based representative sample of Americans, and we have followed them now. We have 2 waves of data on them, and we are looking at the issue of what we call cascading trauma. This year has been a year with a pandemic and economic downturn, demonstrations and protests based on racial injustice. There have been hurricanes, there have been wildfires. It's just been an endless array of cascading events that the American people have had to deal with. And so because the pandemic has made all of this a little different, because it's ambiguous, it's invisible, and it's kind of taken away people's sense of future. So it's created a very unique environment in which to be studying collective stress and trauma. So my colleagues and I hope to continue this study for 5 years. We have a grant pending right now toward that end, and we're hoping we can do it. But thank you for inviting me. It's a really, really important and critical time in America right now, given the stress that we're experiencing, and we're happy to be part of the team of researchers that is looking at that.
Thank you. And we hope you get that grant. Last and not least, I want to welcome Dr. Lisa Gibbs. Dr. Gibbs is a professor in the Department of Family Medicine and the Division of Geriatric Medicine and Gerontology. She's the division chief of the Division of Geriatrics. She's also the director of the UCI Health Senior Health Center, which is renowned and among the nation's top programs as reported by US News and World Report. She's an outstanding colleague and has done important work in the area of dementia care and elder abuse. Thank you, Dr. Gibbs, for joining us today. You're just on mute.
Same issue. Thank you, Dr. Grill. It's a pleasure to be here. We take caregiving very seriously. In fact, we believe caregivers are superheroes, and we address caregiving not only in our clinical world, but in our education world, in our research world. So as Dr. Grill mentioned, I lead the Senior Health Center where we focus on patients over 65. Certainly, we consider caregivers an important component of patient care. In our teaching world, we work with people like Dr. Lee, who's done an amazing job, designing curriculum to train caregivers within Orange County. And also in our research world, we really work on innovations in healthcare so that we can provide the best healthcare to older adults and their caregivers. And not only that, but we've quickly pivoted this year to address the additional concerns that COVID has added to caregiver and caregiver stress. So hopefully we'll be covering some of that today. Thank you.
Wonderful. So we are broadcasting live through Facebook, through YouTube, through the UCI Mind website, and through the School of Nursing website. So there are numerous channels through which people are viewing us today and through which they can submit their questions. And those questions will all be funneled to me, no matter how you're watching. If there's a way for you to submit your question, it'll make it to me. And I will relay those on to our outstanding experts. But to get us started, I think I'll start with Dr. Gibbs and give you a chance to expand upon your last comment. We know that people are understandably hesitant about going to their doctor, but it's really important for people to see their doctors and their nurse and their other allied healthcare professionals. Could you talk a little bit about why we think people should continue to go to their doctor's visits and the precautions that we're taking at UCI Health to make sure it's safe for them to do that?
Absolutely. Yeah, we're very, very concerned about people delaying needed medical care because they may be, concerned and anxious about coming into the medical center. First of all, we've gone to great lengths to make our environment very safe. A lot of these measures you've probably heard about, but we are, doing symptom checks for everyone when they come to work. We are masking, we are social distancing, and we are cleaning, after and before each and every patient. So I think it's a very low risk scenario coming in to get medical care. We really also believe that people should continue their preventative care. So things like colonoscopies, especially vaccines, the chronic medical conditions should continue to have regular care. And that includes diabetes and hypertension, COPD and asthma, for instance. It's so much more important to keep those under control, especially now, because we know that people with those conditions who do contract COVID have a tougher time than people without those conditions. So there are so many reasons why people should continue with their regular medical care. And certainly we must be careful when we're out and about, and we must social distance and do everything. But please be assured that at the medical center, we are enacting every single precaution that we can.
Yeah, that's great. People are still going out and going to the grocery store and doing other things, and they need to go to the doctor as well.
That's right.
But of course, even when we're not in a pandemic, it's hard for caregivers to go to the doctor for themselves in many cases. Dr. Lee, the pandemic is placing unprecedented burden on caregivers of people with dementia. Can you talk about your work and how it relates to what people are experiencing right now during a pandemic as caregivers of loved ones?
So the early the pandemic, like March, when we had the California governors announced the stay-at-home orders. Our team tried to have simple telephone support studies, and then upon the IRB quick approval, we tried to reach out the dementia family caregivers that we already in our previous team. Then they express many their emotions and fears and their additional suffers and stressors during our phone interview and also follow-up call to support their emotional. So first emerging theme that the family caregiver share with us is like providing 24/7 caregiving for their family member with Alzheimer. So before the stay-at-home order or pandemic situation, we often, caregiver often send a person with Alzheimer's to the either daycare or getting some, in-home services. But due to the the abrupt the order of staying at home, we have to be stayed at home. So at that time, early March and then early April this year, even Meals on Wheel volunteer had to stay at home. So even Meals on Wheel were not, maybe a few days stopped. So family caregivers, especially Alzheimer's, they really feeling very additional stress, like being a 24-hour and 7 caregiver without any support, and even hesitate to ask any support from other family members. And then feeling like, what if I got infected? Then what about my person with Alzheimer's? And then if the person with Alzheimer's, if she or he is infected, then what should I do? So it was really a tremendous stressor that they received during this pandemic.
Yeah, those loss of resources during the pandemic has really put an added burden on our family members, and that creates a lot of stress for them. And I think it's important to note that we're many months into this pandemic now. So Dr. Holman, maybe you could explain to our audience a little bit about what prolonged stress can do and some steps they can take to try to mitigate its negative impact.
Sure. So stress has many impacts on the body, but one of the most sort of insidious and most damaging effects that stress can have on your physical body is the challenge it poses to your immune system and the inflammatory response that you get. And those kinds of effects that happen physiologically in response to stress can actually create prolonged risk for developing high blood pressure. They can challenge your heart. People who have risk or are at risk or have endocrine diseases such as diabetes are also at greater risk from stress. So if an asthma, I mean, it's pretty much an all systems effector. So stress has that major impact on a variety of systems in your body. And when you're chronically stressed, your body is chronically running on that high stress mode, and it's wear and tear on the body. And under a normal, I think of it's crazy now, right? I think of stressors like a wildfire that comes and goes as normal, but it's not. Anyway, because of the pandemic, there's so many things that people are contending with day in and day out from one day to the next, that it's just an endless high level of stress. And that's very damaging to the body and to the mind. And one of the areas of my research is to look at that interface between mental and physical health. And some people might think, oh, well, I'm fine, physically I'm fine, but I'm feeling a little stressed, I'm feeling a little depressed or anxious. Well, those feelings are associated with downstream physical health problems. So there is, being depressed is actually a risk factor for having cardiovascular ailments. And so one should not think that just because you're experiencing some mental health symptoms, that doesn't mean you're going to, that's unrelated to physical health. Those two go hand in hand. And when you get physically ill, it can actually create mental health problems for people too. So those two things go hand in hand. And that's the sad thing about both chronic stress and ongoing collective trauma, like what America and the world is experiencing right now.
Yeah, I think we'll definitely come back to that, and I certainly want to hear recommendations each of you might have for managing this really unprecedented level of stress with so many different things affecting all of us. I use the term frequently that our world has been turned upside down by this pandemic, and then there's plenty of other things happening as well. I want to remind the audience that they can submit questions, but we did have a lot of questions submitted in advance of this session. So I want to do my best to try to answer as many of those as possible. And for all three of you, but maybe I'll start with Dr. Gibbs, there were several questions related to when you're caring for a loved one with dementia, when is it time to think about moving your loved one into a skilled facility?
Wow, that's a really tough life circumstance. So, I think first of all, caregivers need to stay healthy to be able to caregive. When the caregiving, role becomes such that there is that chronic stress that Dr. Holman explained or described, to the point where, caregivers are not really able to keep up with proper caregiving, or caregivers are not able to keep up with caring for themselves. Then unfortunately we get to this difficult decision point where sometimes we have to decide that someone is better cared for in a facility. And, honestly, sometimes that's a better decision for some families. Sometimes it's a better decision to keep people at home in certain circumstances. But I think it's really just so important to keep the communication open between family members to know, for each family, what is the right choice and when is the right choice to do that. But certainly when the caregiving needs surpass the ability to take care of oneself and your caregiver, your loved one, it's time to start thinking about different options. If we're not able to, cover those needs by having someone come into the home, or adjusting our schedules, or, looking at daycare settings, or, the other things that unfortunately are not available to us during the time of COVID. But again, a very personal decision for the caregivers and the family members, and one not to be taken lightly, of course. But certainly when, again, when that stress causes it's kind of the breakdown of the proper caregiving. And even before that, these things should be considered.
Yeah, unfortunately, we hear stories a lot about people waiting too long. I think, the decision carries a lot of guilt for many caregivers. Dr. Lee, in your work, have you noticed unique features around culture and caregiver guilt around these decisions, or the role otherwise, and any opportunities to try to help families deal with that?
Mhm. Yeah, I initially studied like an interview with Korean and Vietnamese family caregivers of Alzheimer patients. Then many of them, they express, I'm the family members, I'm the best person to take care of person with Alzheimer's. How can I ask any other help, or sending my loved one to the other long-term care? So it's very related to the culture. And many families also, it's hard to accept. And then many families really deny. So even primary care doctor's office, um, wonderful doctors team try to support the family and also the treatment discussion. But family members many times deny, like, no, maybe my mother or father is no more aging, but just a little bit on and off because maybe something else. So sometimes it's hard to initiate the discussion to really plan to the learn more about the journey of caregiving. And also the family member, especially the Asian family members, they accept the condition very like the time that they cannot really handle within the family. Then sometimes it's too late. But I really strongly support the idea, like, the UCI Mind, UCI Alzheimer associations, and they're having lots of good resources, like, for example, support group. Once a family member join the support group, they can listen some other stories, and then they can feel like, oh, I'm not the only one. So that they can feel like, oh, I have been doing well for my family member with Alzheimer's, something like that. So, depends on the family, like some family really wanted to do the best for the family member with Alzheimer's. Some family like, this is what we can do best. So there is no correct answer, but feeling like, Dr. Gibbs said, like thinking about yourself as a caregiver, not to burn out, then you can provide better care for your family members.
Yeah, and that burnout is dangerous, as I think Dr. Holman's research has shown us, that these long durations of stress really can affect the health of the caregiver. And I know this is known to all of you. Dr. Holman, we also just got a question about research done in post-war situations and comparing, caregivers in Southern California in 2020 to caregivers after World War II. Do you want to comment about what we've learned from previous, major global incidents and how they might instruct us today?
Sure. What we've seen, there's on several studies that have looked at chronic ongoing stressors, some of the most important issues that people can pay attention to help address and cope with the stress that people experience is building what I would call community commitment and integration, helping people, and as Dr. Lee was just talking about, bringing people into a group where they actually can build community with other people who've experienced something like what they're experiencing, but also creating a sense of community and building a sense of social responsibility. Right now, dealing with the pandemic and all of the, as I mentioned before, that cascading set of events that people are facing, one of the most important things that I try to emphasize is the need for people to have a sense of commitment to their community and their neighborhood, doing something to help somebody in your neighborhood. That strengthens your neighborhood, and then in turn, your neighborhood can then strengthen you in return when you need it. And that kind of understanding and social responsibility, I think, is a really important really important issue. And as we have seen in several different places, when people are coping with an event, it helps to be around individuals who have experienced something similar to what they're going through. So, for example, in the aftermath of the Vietnam War, Vietnam vets benefited most from being with other Vietnam veterans, not from being in a generic social support group, but being in a group that supported them as Vietnam vets who understood the experience they went through. Sometimes that's a really important issue for helping people cope in the aftermath of these major kinds of events.
Yeah. In my field, we talk a lot about when we're trying to perform informed consent for a research study with Alzheimer's patients, we have to assess whether they really have insight or awareness to their own impairments and can understand the study. And Dr. Gibbs, Dr. Lee, maybe you can comment, how much do we think Alzheimer's patients are aware of COVID-19? How much should we really be focused on reminding them of what we're dealing with? Obviously, there's a lot of challenges that come with maintaining social distancing from our loved ones if they're not in our home. But should we be watching the news with them if they are in our home? Should we be reminding them of what's happening? Can you comment about dementia patients' awareness of our current circumstances?
Yes, certainly. And a lot of it depends on the severity of the dementia and one's ability to really comprehend what's going on around them. So for someone who has MCI or mild cognitive impairment or mild dementia, of course, I mean, if they can appreciate the fact that there's an illness going around that is contagious and we must be careful and social distance and wear masks, then, then by all means, they should be part of that, that family approach and response to COVID. As people move into, greater severity, moderate to severe dementia, it becomes really challenging. And in some ways it makes persons with dementia more vulnerable to this illness because, there's difficulty remembering to wear a mask. maybe difficulty, you know, to remind people to use sanitizers or washing our hands frequently. And then they may not understand really why, you know, why people aren't getting close to them. And I think that's really a huge challenge in our nursing facility and our assisted living worlds, you know, where this pandemic is really causing a lot of isolation and depression because of those issues. So really, so in summary, and I know Dr. Lee can add to this, but it really does depend on, you know, one's ability to really comprehend the situation.
During this early pandemic, our research team, you know, through the telephone support study, we heard a lot of really difficulties. Family members try to, you know, ask a person with Alzheimer wearing the mask or have to go together to the grocery shopping, but they don't understand the, you know, the 6 feet social distancing. So rather than really like a family caregivers, rather than kind of try to educate the person with Alzheimer's in the situation, kind of try like, you know, Dr. Gibbs said, based on the, you know, the person with the Alzheimer's condition, we have to have some wisdom to make them understand. So for example, like, you know, I'm the only sole caregiver. I have to bring my husband to the grocery shopping. If I just leave him at home alone, then maybe something happened like in terms of safety issues. Then let's bring the, you know, husband to the grocery shopping. Then rather than make him like a really, you know, strict on the, you know, 6 feet, but like Dr. Gibbs said, like, you know, have some like protections, you know, safety protections a little bit more. So it really needs a lot of wisdom to living together, go through this pandemic situation. So and then try to find, you know, family caregiver really need to try to find any resources. If you know, cannot bring the, you know, person with Alzheimer to the outside for the other, you know, the purchasing some important, you know, food or others, then asking some other resources and neighbors to connect it. Another, you know, the strategies. So these days, I think really caregiver needs a little bit more, you know, the caregiving informations. Then how we can go through this difficult situation with the person with Alzheimer living together at home. It's very difficult, but we now see the like a needs for the how we can help the, you know, the family caregiver through multiple different methodologies, like through Zooms and by phones, and, you know, the materials, and then simple visit and other, you know, the methodologies.
Josh, if I may I address something?
Sure. I was just going to real quick say that I think that on some of our channels right now, some of our community partners are sharing resources for caregivers during the pandemic. And we have tried to list various resources on UCI Mind's website for caregivers to access as well. But Dr. Holman, go ahead.
Yeah, I just wanted to comment that one of the things that I think people, that is challenging, especially for people who are living with a mental disorder of any kind, like dementia, is that wearing a mask and covering your face can actually create fear in the person on the other end of that. And so it's an unfortunate reality because the mask wearing is essential for the prevention of the spread of the COVID virus. But finding ways around some of the challenges of the generic mask that hides your face, such as people are starting to create clear masks so that you can actually still, you're protecting the person, but you're still seeing their face and the smile. People have put, you know, images of themselves smiling on their mask so that the person perceiving the mask can actually can actually, feel more positive because they're seeing a smiling face. So there's things that there's very creative ways that we can go about doing things that that I think might help patients cope better with the protocols that are required to protect people from the disease. I'd be interested in hearing what Dr. Gibbs and Dr. Lee think about some of that, but that's been my understanding from a mental health perspective.
Thanks. We have a couple of other questions that have been submitted here. This one's pretty tough. Is there data on how people with dementia do when their care partner takes care of more than one person with dementia? Does the quality of care suffer? And I admit to not knowing of studies that have tried to quantify that in any way, but perhaps our illustrious team does.
I also don't know of any particular studies that address that directly, but in some ways I can see the benefits of that in some ways, because there may be more camaraderie, more social interaction, like in daycare settings where we have settings that are specialized in the care of persons with dementia. That social stimulation is really optimized, and that is so important for the health of our persons with dementia. And we consider that so important that it's up there with nutrition, exercise, and in some cases even more effective than medications. So that daily stimulation, certainly the sensory coming in through the eyes and the ears and the touch, is so incredibly important that in some ways, having a friend or a colleague, or sorry, not a colleague, but a friend go through that caregiving with you might not be a bad idea, as long as the caregiver is not overstressed and overburdened in the situation.
Yeah.
Through my experience with other family groups with Alzheimer's, the person with Alzheimer's, sometimes they don't understand other new people's. I'm very sorry about the noise. Just like that, I warned them, but they don't remember myself. Okay, I think I let me ask them to be a little bit quiet.
Dr. Holman, there was a really interesting letter in the Orange County Register this week about talking to a friend or family member who is caring for a loved one with dementia, and about their burden as a caregiver. Can you offer communication strategies to talk to people you care about their burden and the stress that they're under?
Yeah, one of the things that's really, I think, most important when thinking about how you communicate with anybody under stress, but in particular somebody like a caregiver, is to really listen actively. The active listening and letting a person say what they're experiencing and how they're feeling without judgment is critical. And really paying attention to the emotional message that you're getting from the caregiver, not just the words, because a caregiver may not feel all that comfortable saying all the details of what they're experiencing, and precisely because of the guilt that they may be experiencing, if they may be feeling that guilt. And if that's the case, then maybe they might not say everything they're really feeling, but you might pick up on what they're actually feeling based on watching their body language, the tone of their voice, et cetera, et cetera. So when you're communicating with anybody who's under stress, but in particular in this kind of situation, I would strongly recommend really thinking hard about the active listening, being quieter and opening your ears more, accepting, being non-judgmental, paying attention to the emotional tone of what you're being told, or what you're sensing from the person, so that you can connect with them. Because ultimately it's the connection you build with somebody that allows you to be most effective as a support person for that individual. So if they feel like you really get what they're experiencing, then any forms of support that you offer them are much more likely to be received with open arms than with resistance.
Yeah, I would follow up on that. I think it's so important to understand the underlying reason about why there's resistance. And it just reminded me when Dr. Holman was speaking that I had a patient on call, and I was advising him to go to the emergency room, and he was extremely resistant. He said, well, maybe I can go tomorrow, maybe I can go Friday, And finally I understood that he was the caregiver for his wife who had dementia. And he was really terrified of going to the emergency room, maybe being exposed to COVID, and then really being concerned that if he was sick, who would take care of her? So once I understood, the reasoning behind his resistance, then we were able to have a meaningful conversation about how to take care of himself.
Yeah. Yeah, Dr. Gibbs, a lot of our commentary so far has been about identifying burden on the caregiver and trying to make people understand it's okay to get help. There's a really important question that someone submitted about what precautions you recommend for people who are considering bringing in-home support during a pandemic. It's a double-edged sword right now. So maybe you could speak to that.
Yeah, this is not an easy situation. It is a double-edged sword. In fact, we have many family members who actually did have in-home help, who for whatever reason, had to stop coming during the pandemic, maybe because they had to take care of their own family, maybe because they were exposed to COVID and they themselves became ill. And then as you said, you also face a situation where you need more help because, as Dr. Lee was saying, now this is a 24/7 caregiving situation because you don't have the senior centers and you don't have the daycare centers right now. So some in-home help, would help alleviate, provide some respite. But then, of course, we face a situation about whether we're bringing somebody who's been exposed to the virus into our home. And we want to be sure that they're following social distancing and being extremely careful as well in our home environment. So I think it's, as you said, it's not an easy situation, but we have to weigh the risks and the benefits. And, we have to take care of ourselves. If we truly need that respite, then we do the best we can. And, we find someone who we think is very cautious and very careful about following social distancing themselves, even when they're not in our presence.
Yeah, I think it's really tough, right? It's hard to find the right person to bring in home in a normal situation, and to do so in a situation like this, and to have conversations about whether they're going to restaurants or movies adds a whole nother level. But I think that's the challenge that we have to face when we're thinking about trying to get in-home care. And of course, Jung, I want to hear your perspective on this, because I think that for families of certain cultural backgrounds, it was already hard in many situations to recommend added support in the home. But now we face the COVID challenge as well. And I'm eager to hear any insights you've had from your work in the unique groups that are here in Orange County.
Mm-hmm. So Dr. Gibbs and we are working together to provide caregiver education, especially in-home supportive caregiver. Most of them are family members, but some of them are paid caregivers. And then during this early COVID time, still Orange County, California, the public health allow the caregiver go to the home for the elderly needs of the help. So at that time, we got lots of questions about what about the precautions and the person with Alzheimer's, their family had any COVID-19 or vice versa, but we provide the care, like we need to trust each other, and then we need to be supportive of each other in this very unexpected time and longer right now. So think about if the primary caregivers are too stressed out, really need to plan on some help from outside, paid caregivers or other family members at the time, like a doctor gives mentioned about precautions. As long as we keep the precautions and safety rules, then we trust each other and then helping each other. So it's going to be longer and longer. So we have to keep in mind we follow the safety recommendation, and then the caregivers at helping us at home, and also to follow the safety the rules. And so still there are some culture or the individuals families a little bit resistance to the getting help from outside or inside, but this is really a new era. We have to be more open and support each other in the really unexpected situations to go together.
Yeah. Dr. Holman, I think, one thing that's come up multiple times this afternoon is that a lot of this now has become 24/7 for our caregivers, and some things were already 24/7. The news cycle was 24/7, and there's a lot of news for us right now. And what tips would you give to caregivers for self-care in a 24/7 times 2 sort of life that they find themselves in now?
That's a great question. Thank you. So in our work, in looking at issues, how collective traumas have impacted people, one of the most important findings that we have identified is that the more people focus on media exposure to whatever's going on, the more they pay attention to the media, the more likely they are to experience acute stress symptoms. Now, acute stress symptoms are early post-traumatic stress type symptoms, like re-experiencing, having flashbacks, being sort of on edge and hypervigilant. These kinds of symptoms are much more common in people who are really exposing themselves to more and more media. So it's a very clear, we've shown this in 9/11, we've shown it after the Boston Marathon bombing, after the Orlando nightclub shooting. We're seeing it in our pandemic study. In our pandemic study, we see the more you engage with the media, the more depressive symptoms you have, the more acute stress symptoms you have. And part of that's because, especially the information we've been getting around the pandemic has been very conflicting. We've gotten one story from one place, another story from another place, and then it changes, and then it goes back. And it's very confusing. And that conflict, that discrepancy has been problematic and created greater mental health symptoms in people. And so what I would suggest to caregivers who are on 24/7, that they not be on 24/7 for media, that they cut back their media exposure as much as they can. I never want to say to somebody, put your head in the sand, because you shouldn't. You really do need to keep aware of what's going on in the world around you, but only do it to the degree that you need it. In the morning, maybe you can get the information you need for the day and maybe check one more time, but don't check every hour or every 20 minutes. I mean, some people literally have social media, television, radio on 24 hours a day or 18 hours a day. And they're in just the sensory bombardment with all this media information is not good for you. So back off on the media is my advice. Back off as much as you can. Find your trusted sources, whether they be the CDC, the World Health Organization. Johns Hopkins has a great website with COVID information. There's several of them, but find the sites that you can go to get the most up-to-date current information. Get the information you need, and then shut it down for a while and focus on doing something for yourself. I also, if I may go on one more second, a couple of other things that I think are really important, because the pandemic is so, it's created a life of uncertainty and ambiguity. And one of the things that's happened, and this is especially true for younger people, the sense of the future has been completely just changed. And so our sense of time has been distorted, and people definitely need to have a sense of the future for their well-being. That's a part of our mental health, one of the things that sort of girds our mental health. And so finding a way to, even if you do this in small steps, finding a way to create for yourself some sense of like, what's my future? Maybe if I can't think about a year from now or 6 months from now, maybe I can think about a week from now. What can I do toward a week from now, the future that I want to build? And what little small steps can I set up for myself and then aim for? And then when I accomplish them, give myself credit for doing, to get myself to that future. But giving yourself some sense of a future is really important. And I would emphasize that that's especially important for young people, because young people have been devastated with their future plans just kind of thrown into the wind by this pandemic. And so I strongly encourage people to think about that kind of, goal orientation, giving themselves something to look forward to move forward to help rebuild that sense of meaning in your life, because it's critical for well-being.
Yeah, I'm reminded of a great Yogi Berra quote that the future ain't what it used to be. But I will say that, for my undergraduate students that I teach, and I had some who graduated last year and really had the end of their college career really taken out from under them. And now I've got incoming freshmen who aren't allowed to come to campus or are on campus but socially distant and quarantined. I always take the opportunity to remind them, and I'd like to remind our audience, we're going to get through this. We're going to get through COVID. We will persevere. It's very important that we handle it the right way, that we do everything we can to minimize the impact of COVID by listening to our experts, like the three people talking to us today, and as has been pointed out, the CDC and other guidelines: wear a mask, stay socially distant, do all the things you can. But we are going to get through this, and someday COVID will be in our past, and we all look forward to that, and we all have to do our part to help us get there. I'm gonna pivot if I can. Dr. Gibbs, there's a big and serious question here that I know you will have a great answer for, which is, what should you do if you're worried about a family member possibly being abusive toward the individual to whom they provide care with dementia?
Mm-hmm. So yes, I mean, this is not uncommon. First of all, I think the caregiver needs to remain safe. So whether it's potentially an abusive situation, whether it's verbal or physical, I think there are different degrees of potential harm. So number one, stay safe. Number two, I think, really it's important to reach out to a support system, but also the medical system. So, in terms of finding out why the person with dementia is potentially abusive, right? Could it be, some type of disordered thinking, or sometimes persons with dementia have hallucinations. Sometimes there's situations in which they're refusing to bathe or to eat or to do things that, caregivers feel that they should do. And then they lash out and become agitated. So I think it's important to kind of analyze that situation along with a healthcare professional who can also, make sure medically there's nothing, there's no medical conditions underlying, that behavior, including pain. So clearly, number one, be safe. Number two, please consult with your healthcare provider. And if a situation is, amenable to some type of treatment, whether it's treating an infection, treating pain, or even treating, hallucinations with medications that we do have that we reserve for these types of situations, and situations that really impact the caregiving. We do have medications that are quite helpful. If for some reason the situation just cannot be resolved, then there may need to be, some difficult decisions there to be made. Whereas, this could be one of those times where considering a facility is an option. So there's a long list of things to really do, but, again, number one, stay safe. Number two, no one deserves to be abused. And number three, just to remember that it's usually not an intentional abuse at that point when somebody is suffering from dementia, but there are usually reasons behind it. So if we can, help those reasons, then we might be able to improve that situation.
Thank you. Some questions that came in through the chat. Can anyone offer thoughts about caregivers' health declining after the person with dementia passes away? I mean, I think we're talking a lot about grief here and its impact on health overall, but also, many caregivers find themselves in their role for many years and develop an identity around it. And then the change that accompanies the loss of the person with dementia can have other impacts. Jung-Ah, do you have any observations around that?
I have a little bit personal experience, not my own family, but my relatives have such a situation. So unfortunately, one of the reasons that I are doing the caregiver study, because some statistics say spouse caregiver passed away earlier than person with Alzheimer's. So this is really kind of sad, but maybe fact. So that's why I started, the supporting family caregivers, encourage them to think about their health. So rather than all the time, especially in the Asian culture, trying to center the person in patient like a disease rather than the caregivers. So feeling some guilty feeling if I'm thinking about myself rather than the person with Alzheimer's or person with a disease. So, but if we really kind of thinking flip side, then having good caregivers well-being and health condition that eventually have a better care support for the person with Alzheimer's. So these days, many aging couples and spouse and the team, they live alone. Like adults, children are living far away. Then, so the couple, needs to have a early on discussion how we can work together in this journey. Like I can, my another relative family, they both aunt and then husband has Alzheimer's together at the almost same time. So it's very sad. But as long as we try to understand the situation and then try to learn more the resources and then knowledge and then get help or ask help. And I would like to emphasize one thing. Caregivers, please join the support group or open, your mind, sharing with other, neighbors and families and the friends, so that be connected and and express the appreciations when they receive the help, rather than I can do the everything by myself, that kind of the momentum. But now without working together, I think it's hard to get over these important situations longer than we expected.
The other, sorry. I can add to that, Dr. Grill, if you would like.
Please.
So the other thing to consider too is that oftentimes caregivers delay their medical care, and I've had many situations where caregivers come in for health care once their spouse dies, and they want to catch up on their colonoscopy and everything else. And unfortunately, I've had cases where people find out that they have cancer because they've put off these necessary preventative medical tests too long. Or perhaps caregiving is a chronic stress situation, and if someone has a condition such as diabetes, the diabetes is then worsened by that condition. And sometimes people, again, don't take care of themselves. And then by the time, enough years pass, that they're suddenly facing complications. So I think the guideline here is, to continue to take care of yourself and your chronic conditions and your prevention and all of that throughout the caregiving years.
Yeah, it's definitely a commonality of things we've been talking about for the last hour. One common thing is that we really urge people to remember to take care of themselves during this pandemic and afterward and beyond. We really appreciate all that people are doing for each other out there, and hope that they do remember to take care of themselves, because it is a common story that we hear of people, putting their loved one's health before their own. I think another commonality of COVID, Dr. Holman, is isolation for older people who are worried about getting the virus, for caregivers who are worried about themselves and their care recipient getting the virus. Can you speak about the implications of social isolation that has really been prominent for so many for the last 8 months?
Absolutely. Thank you. Isolation is very highly risky and potentially damaging. It can lead to greater symptoms of depression, anxiety, all kinds of mental health issues, but even more so, the more isolated a person becomes and potentially lonely as a result, that increases their inflammatory process in their bodies. It's been associated with greater risk of a stroke. There's a very large body of research now that has really shown that issues of isolation and loneliness are terrible, not just for your mental health, but for your physical health. And so this comes back to the issue of finding ways to provide support to people, right? And how do you connect people in the context of this pandemic? And obviously, we do a lot of Zooming, we do a lot of these, things, and people are finding ways to create, social connections through the internet, and that's great. And hopefully, once we've tamed this pandemic, we can get back to a more normal experience. But it seems to me that having people again, be integrated into their community, where your neighbor knows what's going on, something about what's going on in your life, and can actually offer a helping hand, maybe go to the grocery store for you, and then come and share, leave things for you and groceries for you, but then maybe at a physically distant way, talk to you about that and say, oh, what are you going to make with those groceries? Or, just try and, finding ways to make communities tighter, to bring communities together in a tighter way, I think is a really important way to combat some of the isolation that people are feeling, and taking that responsibility and thinking to yourself, I live in this neighborhood, I depend on these people, they depend on me, I need to do my part to make sure that this neighborhood is safe and secure and connected. And so being willing to take those extra steps, I think, is a really important thing. Josh, I don't know if Dr. Gibbs lives in Uni Hills, but I can tell you, there's been some of that going on in our neighborhood, actually quite a bit of it, people working together during the pandemic to try to help out each other. And I think that is a really important phenomenon that I think can be helpful in dealing with the damage that isolation and loneliness can bring.
We've definitely heard some wonderful stories of neighborly behaviors and people going out of their way to help others in these very difficult times. Dr. Gibbs, there are some questions that are not particularly COVID related, but are certainly important. There's a question about sundowning, more or less just kind of trying to understand what sundowning is and advice we might give caregivers for dealing with it.
So yes, so sundowning is really a period of increased confusion that persons with dementia may experience in the afternoon or the evening. It does seem to have that circadian or time aspect to it, and it normally happens a certain time of day. So I think the way to really deal with it is to really have a plan. So for instance, if we are knowing that somebody's getting more confused in the late afternoon, then maybe plan a certain activity at that point, which could, be calming, or which could ease distraction. And again, with sundowning as well as other behaviors, we prefer not to use certain medications, such as antipsychotics or medications that do have some element of risk. So we really do like to use non-pharmacological or non-medication related solutions for these. So I think, the main thing is to know what it is. It does happen very, very commonly with persons with dementia. If you understand what the pattern is and you notice something different, increased confusion or so forth, then that might be a reason to go to the doctor and find out if there's some underlying infection going on. But certainly caregivers know their loved ones the best. And, just I think if you're dealing with a sundowning situation, again, just understand what it is and what might be a more calming activity or calming environment for your loved one during that period of time during the day.
Yeah, that's great. And, I think it's worth saying that dementia patients often do better with routines. And you can introduce into your daily routine something in the afternoon, early evening hours that is a calming opportunity, or music or cooking or different things that distract the person or occupy their mind in a positive way that sometimes could help. Dr. Lee, there's a question in the chat about the use of technology to provide support. I ask you this, of course, via Zoom. And our audience is obviously here on Zoom, but do you have, outside of the obvious, Zoom support groups, are there other technological advances that you might recommend?
My current, during the pandemic, the experience actually Zoom like, the videos, video teleconferencing is the advanced one, but we still try to understand individual, families and then their like available technology. So like some, these days Alzheimer's Association or other, the Alzheimer's serving organization provide phone support, or even like outside, more in old style, but outside, and then having our limited number of caregivers and having the support groups. So even the advanced technology is also really good, but we need to understand individual family members, the situation. So some family member may only use 2G phone, like the landline, or even we are doing some Zooming or things. Some family member doesn't have Wi-Fi if they are living in the only the older adult spouse caregiver only. So then Zoom or the internet-based support group or services can increase the phone bills. So we have to be a little bit more considerable for the individuals. So, but this is the time actually. Some older adults maybe technology is not my things. Then I will learn at the end. But this COVID time, we learned like the power of technology. So let's say some savvy caregivers or savvy elderly can help friends who are less savvy, the family member to like how to use the Zoom-based support group joining or other type of the services right now available more and more planning by other organization and even the telehealth visit. Yeah.
Yeah, no, absolutely. And I'll turn it over to Dr. Gibbs to maybe talk about telehealth, but I'll just say that obviously we're a research organization and technology has always been key to research advances. And if anyone's interested, we did host a conference this fall by Zoom, or this fall by Zoom on technology's role in research. And we had a fantastic talk from a world-renowned expert, Dr. Alex Michaelides, about technological advances to support dementia patients in the home through smart homes and other really cool technologies. And that's available on the UCI Mind YouTube channel if anyone would like to watch it, or other talks about the advances in technology to support research. But I know that our providers here at UCI Health have been seeing patients in person as well as through telehealth visits. So maybe Dr. Gibbs, you could comment about the importance of that.
Absolutely. So yes, as you mentioned, we've really modified our approach. So we're available via telehealth, meaning video, as well as in some cases telephone, as well as in-person visits. And that's been really, really valuable and helpful in ensuring that certain people can continue to get care. For instance, when COVID, came upon us, a lot of the assisted living facilities basically closed their doors, and they said, no one can come in, but you can't leave either, because we don't know if you'll be exposed to COVID while you're outside our facility. So really being able to use telehealth and see them via video was a lifesaver in terms of access to healthcare. I also on the topic of isolation, we've started to notice that a lot of our patients with dementia, have not done well in environments where they're isolated. And again, that social stimulation is so critical that, when that's not available, it really does make the dementia worse, and it increases the feelings of depression as well. So in many cases, we find that, if we can have family members or themselves learn how to use virtual visits like Zoom, then they can continue to, participate in their support groups and, potentially their Bible studies, or, the groups that the friends that they normally get together with, just in a different way. So we're finding again that, as Dr. Lee said, there's a digital divide. There are patients that don't have devices. They may not have the internet. And, these are people that really are not going to be able to keep up with the interaction as we move forward. So digital technology will become exceedingly more and more important in our world, even after COVID, for all older adults, but specifically those with dementia as well.
Yeah, absolutely. And the last statistic I saw was that there are 80,000 people living with Alzheimer's disease and living alone in the United States. And of course, this is only going to continue to increase as more and more people are living to the ages when Alzheimer's disease risk goes up exponentially.
Right.
So we've got about 15 minutes, and dare I say that the pace of question submission has slowed a bit, and I feel like we're relatively caught up. So I might propose that in our last 15 minutes, we'll do some closing remarks from each of you. And I'll just start with Dr. Holman and give you the floor, and then we will wrap up this fantastic session.
Great, thank you, Josh. And I think one of the things as in listening to the comments from Dr. Lee and Dr. Gibbs and hearing the questions that were asked, one of the things that strikes me is I think we need to think about the intersectionalities that affect people's care. And what I'm trying to say here is, you know, older people do have the worst outcomes with the pandemic, right? But older people who happen to be poorer are also at even greater risk. And older people, and we've had issues in the country lately in which, you know, people have been unable to pay their rent. And some people have been put at the risk of yet another in this cascading events that people are experiencing of economic downturn, and then maybe they're not being able to pay rent, and then maybe they're being threatened with eviction. And when that happens, that's a real danger to not just old people, it's a danger to everybody, but the people who are at greatest risk here are the poorest people, the people of color, and older people who fall in those groups. And I think it's really important that we think about providing the kinds of resources that are needed to the specific groups who are at greatest risk for the worst impact of this pandemic. And that means finding those intersections of risk. And who does that mean we're going to funnel our resources to? And making sure that we put our resources there first, because that's really the only fair way to address what's going on with these risks and to mitigate the spread of the virus as well. When you stop and think about it, stopping people from being evicted and on the street is going to help stop the spread of the virus, because the more people are kicked out onto the street, or the more people who are struggling in that way, the more likely they are going to be they are going to be exposed to the virus, and then that starts to spread in communities. So I think it's a really important issue that we think about how we can do address the issues that people are, the real challenges that people are facing because of the various types of stress and trauma that people are experiencing as a result of this pandemic. I think that's critical. And especially, as I mentioned, into communities of color, the Indigenous and Black and Latino families have been experiencing the worst of this pandemic. So I think it's very important that we think about how we're going to allocate our resources. Just one last other thing that I think is critical, and I'm just going to reiterate it, is that people need to protect themselves by not overexposing themselves to media, and to find ways to even if you do just one little thing you do for yourself every day, it doesn't matter how big it is. You might, oftentimes people think, oh, I'm going to start exercising. And so they say, I'm going to exercise 5 days a week, 2 hours a day. And they're going from 0 to 200 in, 30 seconds. You can't do that. So even if all you do is like add 5 minutes of some kind of self-care in a day, that can be very helpful. And you just add a little bit, even if it's just a little bit, that's a good step. And so when you think about doing self-care is it's not about having to take on all these burdens of things that you have to do. It's actually deciding that for one little decision, like maybe what I'm going to eat right now, or what I'm going to do when I get up in the morning, maybe I'll just, go for a walk for 10 minutes. Those kinds of things, that's self-care. So it can be very simple and relatively easy to implement if you give yourself permission to do it in a gentle way, in a loving way, in a compassionate way for yourself. That's really critical. And that to me is one way that we can show compassion, not just for ourselves, but for each other, in accepting and understanding that that's a way to be taking care of ourselves during the pandemic. And I want to encourage everybody to do that. So I'll be quiet now.
Great message. Dr. Lee, would you like to make some closing remarks?
Yeah, I totally agree with Dr. Holman's suggestions. Actually, from the back, like the initial, NIH funded our, Dr. Gibbs and I, we proposed home visitation for the family caregivers. And then actually we used, some technology monitoring caregivers' health. Like these days, many people use smart watch, and then or smart ring is easy to wear. Then there is a commercial apps that we can just download to our the phone, and then we can tracking our health through the the how many steps I'm walking today, whether my sleep is good, whether sometimes the smartwatch remind us like, oh, you are stressful, the take time to deep breathe, something like that. I was like, I tested myself like, oh, wow, really, really smart. So we are using those technology to support caregivers to focusing their health. And hopefully, we can recruit well for our study, and maybe our home visit research team can visit home is reduce their isolation feeling too. And then another these days I'm receiving the request from low income apartments. They seniors living alone usually in the the apartment complex. Then family members are living far away, or there's no family members to to deal with the situation. Then I think our the academic university and scrub nursing, scrub medicine, or other schools, we can work together with the community partners and also the communities. So we work together, and then improving the community, the dementia-friendly environment and aging-friendly environment. So through this pandemic, I think we really have more understanding of we have to work together, as a partnering, the academia and community work together. Yeah, that's my last comment. And then thank you so much for having this, the webinar for the, the community needs and answering the questions.
Dr. Gibbs?
Yes, wow, I don't know. The last two speakers are so eloquent. I'm not sure what I can add to that, but I would like to reiterate what you said. This will pass. It may not pass as soon as we'd like, but this difficult time will pass, and I think we're learning a lot of lessons now. And we're learning how to do things differently, which I think will actually help us in the future. We're learning, how important it is to address the digital divide so that everyone has access to devices and technology and the internet. We're also really learning how, important primary care is, again, and value-based care, and access to healthcare. So we've made a lot of gains in the last few months that paradoxically we may not have made in this amount of time. So I think, at the end of the day, we'll take the good of what we've learned. We'll leave the pandemic behind. And, we'll continue to support the caregivers and our patients with dementia. We've pivoted, and we're offering now telemonitoring. We're offering a special assist program with Dr. Lee, where we have medical students and nursing students available to reach out to people that are isolated in their homes. So we'll continue to do the good work, and just encourage the audience to continue to take care of themselves. At the end of the day, if you're not taking care of yourself, you won't be able to take care of someone else in the best way. So thank you, and thank you for the invitation to participate.
Yes, thank you very much, Dr. Grill.
those are all great messages, and you know, let me on behalf of the audience offer a round of applause. Our panelists were outstanding and gave so much tremendous information for the community at large, and especially our community of caregivers. We are deeply appreciative of the people providing care and our community of supporters, and we're deeply appreciative of our colleagues from UCI Health and the School of Nursing for joining us and offering such tremendous and wonderful information. I would urge our audience to do everything that our panelists did to really take the time to care for yourselves as well as each other. And I definitely want to close with some optimistic that we're going to come through this. We're going to come through this together. We look forward to seeing our community in person doing events like this. But I think Dr. Gibbs is absolutely right. We're going to have to remember to learn from this and reach through different channels and become stronger as a community and as organizations as a result of surviving COVID-19 and 2020. I just want to finish by again thanking our speakers. Really, just I hope our audience appreciates what a tremendous opportunity it was to hear from three renowned individuals from here at UCI. I'm honored to work with them. And until we meet again, please take care of yourselves and each other. Thank you.
Thank you. Thank you very much.